All right, welcome to our guided tour of the diaphragm. Now, you probably think of it as just the main muscle for breathing, right? But it's so much more than that. It's actually a super complex gateway that has a huge say in our blood flow, our digestion, you name it. So let's jump right in.
So what is this thing really? At its core, the definition is pretty straightforward. It's a musculotendinous partition. That just means it's part muscle, part tendon, and it acts like a big, dome-shaped wall separating your chest cavity from your abdominal cavity. But as we're about to see, calling it a simple wall doesn't even begin to cover it.
Here's the game plan for today. First, we'll look at the big picture. The diaphragm is this great partition. Then we'll zoom in on its anchors, the muscle and tendon parts. After that, we hit the main event, the three major openings. We'll even touch on some minor ones before we wrap it all up with a clinical recap and a really simple mnemonic to help you remember everything.
Okay, let's kick things off with section 1. We're going to start by looking at how this thing is actually built and why we call it the body's great partition. It's not just one big sheet of muscle. Right in the middle, you've got this tough, fibrous area called the central tendon. Think of that as the bullseye. All the muscular parts start from the edges. You have the sternal part from your breastbone, the costal part from your ribs, and the lumbar part from your spine. And they all converge and insert right onto that central tendon. So moving right along to section 2, how does this massive structure stay put? Well, that lumbar part we just mentioned is held down by these incredibly powerful muscular legs, or anchors, called the crura. Now here's a really cool detail. These two anchors, the crura, they're not symmetrical at all. The right crus is the big brother. It's longer and wider, and it attaches all the way from the L1 to L3 vertebrae. The left one is a bit smaller, usually just coming from L1 and L2. And this difference isn't just a random quirk. It's actually super important for one of the diaphragm's other big jobs. We'll see why in just a minute. So what connects these two muscular legs? That's the job of the median arcuate ligament. It basically forms this fibrous bridge that stretches between the two crura. And in doing so, it creates this perfect archway right in front of the spine. An archway that protects one of the most important blood vessels in your entire body. All right, this brings us to the real heart of our tour. The diaphragm isn't a solid barrier. It's more like a busy border crossing with 3 major official gateways that let crucial structures pass from the chest down into the abdomen. And here they are, all laid out. This is the money slide. We have 3 openings at 3 different levels. The Caval opening at T8, the esophageal hiatus at T10, and the aortic hiatus at T12. The key thing to remember here is the pattern, 8, 10, 12. Just lock that sequence in your brain. So let's stop and think about this for a second.